Okay, let's start. It's my honor to be here to share my experience in the AI application in medical field. Unfortunately, I cannot join in person because right now I'm in Beijing for the visiting professorship at Huang University and the Beiyang University. Okay. So before I started, I joined the DQ in 2014. Before that, I worked almost 30 years in the medical field as the medical physicist in hospital in New York. So today I'd like to share some my experience and some my knowledge about the AI application in medical field, but I will focus on diagnostic image and the radiotherapy. So right now, the cancer patient most in their mind is not how to cure or survival. They are thinking about the safety because for past, so couple of the serious, treatment-related accidents in the world. The one shown in this picture, that's a gentleman only 34 years because of some error happened. So he after treatment, he died after 6 months. So he has a lot of the a report about the complication or accidents in the radiation medicine. So here for the medical health team, it's just not only to prevent the errors, just try to keep the errors not injure the patient, or the result is not so too bad. So all the so AI can help to minimize the accident because most of the accidents come from the human performance, human error, not really machine error. So we like to in this field, we like to with the AI application, we can make the radiotherapy towards the system thinking.
You're gonna have to wait a bit. We might have more people coming in tomorrow.
Yeah, there's people checking in tomorrow.
And more efficient, more precisely,
You too.
A auto process. So here, I think you are in this club. You should know
That was always one of the easiest questions for me to answer.
Artificial intelligence is different now.
If you come up
intelligence, we
and
read
whatever's
a
that,
lot of book.
until then,
We learn a lot of the knowledge,
Yeah, well,
so we can build up our skill and knowledge. But for the
it's
artificial
pretty
intelligence,
It's really just
we
just want to make sure that no
just
one's
use
registered
data.
already, or if they
That's what
register,
we
then
call the
change
machine
one.
learning.
it's kind of a priority thing.
Yeah.
Could someone turn off the speaker?
Yeah, sorry for the interruption, Dr. Huang. Strada, can you mute? Yeah, there's noise coming. Yeah. Okay. Is it better?
Yeah. Okay. So for the deep learning, I think you're all familiar with the process. We need a training set, and we also need a test set. So we come out of the performance estimate. But to some point, we may need more data to reduce the error. But at one point, I believe even we provide more data, but I don't think so. They will help to reduce the error. So here, as a general AI project workflow from that in medical field. That's from the data acquisition and all the way to the model training and the model selection or to the application. So here's some example. Have been AI application in a healthcare example. First of all, like the drug discovery, and also very famous is robotic surgery. That's sometimes we call the intervention. That's we use the to help the surgeon to do the surgery. And what we need, what the challenge today in the radiotherapy field. First of all, we need the dose is more accurate. And also we try to localize the tumor location. Then lastly, we like to make it more efficiency for our treatment process. So the solution is we should have a better, we call the treatment plan. Just mean the design a plan how to irradiate to let the most dose go to the tumor, and only few dose go to the surrounding normal tissue. And also we so-called see beam better. That means we like to make the image resolution higher and clear for the physician to make a diagnosis. Then to get all the purpose, we need more AI to do that. And here is general picture how the AI can help in image and radiotherapy. For example, image diagnostic, they can help a physician to do the first-hand diagnosis for the disease. And the second is segmentation. That means help a physician to outline or counseling the target at a different organ. And the localization, that help the physician to localize the location of the tumor at a different normal tissue. And another is AutoBrain. That's been doing a lot. Maybe I believe at least 10 years. People just try to use AI to help to design the perfect or the better the treatment plan. And the other ones just like auto prediction. That's a new area because for now we have to wait until the patient finishes all the treatment. Then we'll see the treatment is successful or not. Sometimes after the complete treatment, from the image, we may not tell it's successful or not, because sometimes we need the time for the radiation to work, to shrink the tumor. So now we try to use the AI help to predict the outcome. Even, for example, even we through 1/3 of treatment, and we find out this technique is not really good for patient. We can stop it, or we can modify our plan. That's what is called the outcome prediction. Another thing is we try to do the quality assurance for the machine and also for the clinical procedure to make it more safer. Make it safer the procedure. Then we need the AI help to transfer our image, and also we call it image reconstruction. Just so we can get the raw data for different machine like CT, like MR or ultrasound, and we can use the Mathematical format to reconstruct the image. But that is very tedious work. So we like the AI can help us to do the image reconstruction. And over all these, just we can make a remote diagnosis and a remote treatment plan design. Because we know in China, not only in China, all the countries, I think that in city, maybe they have very good medical the resource, but in countryside, may not. So if we can develop a good remote diagnosis and the remote treatment planning, then the doctor in the city can help the doctor in the countryside do the better job. So next, I will give you some example to see the AI being applied in the medical field, or they do now or in the future. So here is image diagnostic. So we use the AI based on the deep learning. We can train so many different cases. For example, we are to diagnose like COVID-19. We are from the lung disease. We will try to identify which one is caused by the COVID-19 virus, which one is not. So we can use the data to train the AI to help to diagnose. They give you plenty of the image from the like the CT or MR, and based on their training, they can tell us where is the abnormal cell. Also, this cell is come from COVID-19, I mean the virus, or other virus, or maybe even the tumor. Okay. So this we use different. Actually, you are in this. You know the unit. That's one of the very popular deep learning. The machine can do that. So that's image reconstruction. So we use the help. We can reconstruction the image we need and compare with and they can help doctor to identify can identify where's the tumor. So here's another example. This is to identify some abnormal cell location, and here it is just the structure or the structure, different structure in the image. Another is segmentation. Segmentation, you can see the right hand here. They just use the AI to help to draw all the target and the different organ surrounding the target. Because for the treatment, when we do the treatment, we need to avoid that. So that we can use AI help. They can do much faster than human being. Okay. And another thing is just find the tumor location. Here's some examples here, and we can use different view. For example, transverse view and sagittal view or coronal view, and also we can combine different modality to give us some good result. For example, right now, most popular imaging modality, one is CT. I think you may all know this CT. Another in MRI. But MRI is basically a better resolution for the soft tissue. But the CT can do some other stuff. They're better in the bone. So depending on what you need, we may make the fusion, just a weaker distortion for two different image. But if we use the human being, and we have to find out how to fusion these two image, because we need to find out a couple points, at least 3 points, identical point between these two image. But if we train the AI through the deep learning, they can, based on their training, can give us better result. And here's the image transfer. That's basically just try to try to help the countryside, the doctor. So there are two things. One is transfer between two different type of image modality. So here is like the MRI to the CT modality. So here basically is MRI image. And the first method is by human being, that's the anatomical structure. So we try to match, try to transfer the MRI image to the CT image. So that's the way we do now. But right now we try to use the deep learning, use the train the or transformation. And here's the AutoBrain. So this is we call the treatment planning, and that should be the tumor that we call the target. So the different line, just different dose level. So we high dose level, we are surrounding the tumor, but outside that's a normal tissue we try to protect. So right now with the help from the deep learning, we can make our plane from 1 dimension is go to the 4 dimension. That's including the timing, because they breathe, the organ motion. There were different time. The tissue, the target may be at the different location, and also you can make the calculation, because we need to calculate the dose at a different area. But right now we use the theoretical method we call the pencil beam, and now kind of same as like AI trade with Monte Carlo. So if people have the interest in the coding or in all these area, I believe Monte Carlo will be a very good tool, as well as the AI to apply in the medical field. Especially Monte Carlo can speed up the calculation and make the result is more accurate. So from that, we can use it. We can come from the manually planning. Generally, we may need a couple hours, maybe a couple of days to finish a complicated plan. But with the help for the AutoBrain, maybe only less than 1 hour. So that's a very great approach with the help from the AI. And that's the outcome prediction. That's the outcome prediction. So here you just come out one voxel, then you can from here. That we can see in the scan, and one is planning, and here is trivial scan. Then we can see what the result changed from here. And on the right, that's all. That's a very busy slide. Just tell you there have been a lot of study to use the help of the AI to predict the outcome, and also predict the toxicity to the normal tissue. And another thing is for the machine QA, machine quality assurance. Before, if with a human being for the annual calibration or annual QA, we may need so many keys, and sometimes need at least 3 or 4 days to finish one machine. But right now, some company they develop the AI to help out. So you need to only set up all the phantom to measure, and then we start the auto process to finish all the measurement. And so now the timing can be very fast. And here is we use the AI to determination of the lung function, because the lung function can see, especially COVID-19. COVID-19, that's the people most suffer from the lung function. So now they try to find out which area is low functional area, which area is higher functional area. Then we focus on the low functional area to see what's going on, either by virus or by what. Okay, so here is a predictor image. Here is ground truth, and we can see that predictive with the AI, and we can see the blue one is low functional area, and the yellow one is high functional area. So we can see this prediction is very, very good. We can identify here without the doctor go through different method or different image. With the help of the AI, we can identify this patient. Here have the low functional area. So what's going on here? They can do the further investigation to see what's happened here. And also here's another example. Okay, and they've been applied. That's the current couple of university or medical center do this kind of research. They use different method like unit, attention and unit. Then also another method, and they can identify, and they find out. I find out this is probably the best way to do it, because it's more clear. I don't see you can see that. This is the low, this high, different. I mean the functional area, but you can see here on the top, a small area, right? That's another functional area. But for the other method, for example, here, they cannot predict, right? They have another one, small one here. But here can predict with a small area with different functional area here. Okay. And also that's COVID-19. COVID-19 that's been do the lot of study. And here is the regular CT image we call it transverse image. And here after reconstruct, they can different view to see because this is transverse just slide by slide. So you have to go over maybe like 30, 40 slices to see what's going on. So here only represent one slice. So that's it's very inconvenient. So we can reconstruct because we call the coronal view. Coronal view just go this way. Study the face go this way. You can see whole lung here, and we can see early stage, right? Have some problem about the lung function. Then they start to progress. So you can this area become more and more, right? And heal up, right? Then after treatment, they better. So that's use you use that to help the doctor a lot. Not only can find out what the area been affected or been damaged by the virus, and also virus also can see the development. Okay, so like this, probably it's very difficult to get back better. And here is another mostly to the lung cancer. Try to use the first of all, you got a CT image, and after you train, they will do segmentation, just means slide by slide. Then also they divide the area, right lung and left lung, and they can see, they can find out the cancer cell, or that's the abnormal cell here. So that's stage one. Is you see the cell body is very small, and here's 3D reconstruction from the CT image. So after, if you don't treat, the stage two will become bigger now, right? And here's stage three, almost covered. At stage four, you see less, but it's not really less because they spread out to other areas. Okay, so that's also one of the AI application can help speed up to identify where is the normal tissue, where is abnormal tissue. And where is another image style, image type we call the PET. We call the PET. And the PET is a different CT/MR. In clinic, in professional CT/MR, we call the anatomical image because they can see the anatomical structure very clear, but we cannot see the cell function or cell characteristic very easier from CT/MR. But for the PET image, we call the functional image, or sometimes we may call the molecular image, because for the PET image here, it's very difficult to see the anatomical structure, very, very unclear. But you will see very, very clear about the cell characteristic or cell function. You can differentiate is normal or abnormal. So here is before treatment. Here you see you can before treatment you can find out here is what is very clear, but we don't know. We are not very clear about the anatomical structure. We know maybe in the head, but where exact location we cannot see it. But we can see this very bright. This is another uptake information. So definitely this is some very unusual or abnormal cell here. So here another patient, here another patient. But still, we cannot see very clear where is that location. Okay, and here just mean during the treatment, not even a complete and here ground truth, and we see the tumor is reduced or tumor is reduced, right? Here is not so bright. That means uptake is not so clear. So that means their function, their abnormal function is reduced. And here also, you see, here almost back to the normal. And here is the AI prediction. You see, you can see the compare is very, very close to the ground truth. So that's why that's the one I say we can do the outcome prediction. So that's a lot of research been going on in the medical field that we try to we try to predict the outcome even before the treatment process completed. Now we talk about some challenge. This challenge may not exist in the other area and other field, but in the medical field, here are some challenge I personally think we should overcome this kind of challenge before we can make it better or make the doctor really believe the AI prediction. So first of all, it's we have a small, simple the simple size, or we have the small database. I think you do the AI, you know, we need the data to train them to make it a good job. But if you don't have enough data, just like a human being, if you don't read another book, for example, if only graduate from high school as compared to graduate from university, I think you are in some professional field, your knowledge is less. So AI also something you need a lot of the data to train. Unfortunately, in medical field, it's different from the economic field or some other field. They have a lot of data, so they can build up very beautiful model to predict or to help. But in the medical field, especially in the radiotherapy field, we don't have some cancer. We may have like a lot of data. For example, is a lung cancer, it's been the #1 in China, or breast cancer, the #1 in women in China. We have a lot of the data, then we can train our AI. But for others, they have only maybe a few, not many patients. So we have less data to train. So that's the one problem in the medical field. So another thing is how to explain. So that's a big problem because when the AI, in the medical field, they use the help of the AI, but they don't design AI or design the coding or whatever by themselves. They just use some different model and try to use, and maybe like they can do some modification only. So eventually they do not really understand what is AI doing. So for the medical field professional, they think the AI is like a black box. So that's why even the diagnostic image, they have a lot of data. But I believe most of the doctors still not believe what is the result. And so AI, my opinion, if we in future, if we want to make a more application or in the medical field, then we try to know what we need, what's going on, what is the result, and why come this result, and also we need to evaluate the risk if the result is not right, or some happen, or someone try to sneak in and do some modification in the coding you use. You may it may happen you lose all the patient data. That's a very serious event because that the patient that's the privacy. And another thing is we will see the data we train is not really robust because they have the different algorithm to do for the different purpose. And also we may find out sometimes laboratory result is not necessarily the same as clinical result. Just like we change the robot, I put the one box by one box, right? But they forgot in their wheel here, so they will move and even falling down. So that's another problem I can see about the algorithm. And another thing is about the permission less or permission, the blockchain. So that's another issue I think you should know because anyone they can modify, they can do all these and may make some serious problem. And they have a lot of unsolved problem. This is one of them because for the radiotherapy, the problem for us is try to take care of the organ motion. So you can see the right hand, right? Here's tumor, yeah, your lung cancer. You can see because of the breathing, so you can see the tumor is move around. So it's very difficult to really hit the target. So that's why right now they try to AI help try to make. We need more imaging modality to take care of this equation. And even we need to involve the timing. So right now they have like a so-called the 4D CT, 4D MR, even the 4D ultrasound. But the 4D we need to make a different phase because different phases they have a different location, and we try to make it more clear or more accurate. We need to divide into so many phases. Each phases we look at the tumor. Then we can combine as one image. But however, if you involve the more phases, then it's very time consuming, and also it's very difficult for human beings to take care of that. So that's really need the AI to help so we call the tracking, that's organ motion. So in clinic you can see that. For example, the breast cancer being the first #1 cancer, new cancer for the woman, but for the death, for the cancer death is not a breast cancer, it's lung cancer. So that means lung cancer probably right now is a very tough cancer to treat, and one of the reason is because lung is the move. So your target will move with the breathing. So it's very difficult to locate the target, give the enough dose. And another thing related to the AI is we call the radionomics. That comes from genomics. That means before we study the patient, we just by one slide by one slide or by image by one image. But right now, with the help of the so-called radionomic, we can find we can get a different type of the image. A different type of image, then we can define the area we want. Then we can, from each image, we can extraction the feature we want. Because each image, they can represent a different feature. So if without the help for the radionomic, the doctor have to review through so many image modalities, and very difficult to make it very clear. So with the help of the Radionomics, we can extraction the feature from different image modality. Then we can select the feature for our purpose. You want to do the diagnostic or you want to do the treatment, you have different purpose. So you need a different feature. Then we collected this feature to our outcome. So that's probably even newer as compared to AI itself. So here you can see that's from different, like for example, from the anatomical image, from physiology, from all these, even from cell characteristic, we can select different feature. That then we find out. After we can extract a different feature. Then we select the feature we want. Then we apply to our clinic. So for now, for example, if two persons with the same cancer, for lung cancer, for example, at the same location, same size, same stage, everything is same. So basically, we do the treatment, the plan, how to treat is the same. However, out of the treatment, one may successful, they have a good outcome. Another one may die. So that means right now our treatment plan or the plan to how to irradiate the tumor is not customized, not personal. We just general, depending on the tumor site, location, all the information. So after we apply the Radionomics with the deep learning, then we can really make personalized the treatment plan. So here just give you some step. I don't want to go detail on that. So you just segmentation, and you just the extraction the feature, and we just take out the feature we need. Then we call that we go feature reduction. Then we can, for example, we do the lung cancer study, or we are identifying lung cancer. So we can, for different feature, we can identify which feature is most important. Is the most important or most factor to cause the lung cancer. So we rank for that. Then from that, we can select the feature we needed. Then we can classify that. So we can do the really personalized the treatment plan for each person. And here is the Radionomics workflow. I don't want to go to detail here. Here 17. That's the Radionomics. That's the medical image from the then. So we can compare the outcome and make a detection for what we wanted. Okay. And eventually, in the medical field, we have right now. Not only AI, we have a lot of application. Many field like internet, like cloud computing, 3D print. I think big data, all these. So medical field right now they need all different professional contribution. Not only the medicine. We need so many to do that. And we find that's probably a little bit old. That's maybe 5 years after that. So some we still develop. We still have a long way to go. We have room to improve. To our to work to really meet our requirement. Okay. So here like all day. We are overestimate, and now we may underestimate. So we still need to long way to go for that. Okay, so that basically I want to say, so here's my taking home message. That means AI, even you have big learning, machine learning, deep learning, all these can help the medicine or medical field, especially radiation medicine, to work and serve more efficiently, and high prices, prices and auto procedure. And AI is a so-called, I think people may know the medical field, just be combined with the clinical field to do the diagnostic image and the treatment planning. So in that, AI is very important tool for this field, and can do some research development in the medical area. But they still has some unsolved problem for you guys to find the solution. And here, final, just pick some advertisement. Just if you are interested to learn more about medical fields and the AI application in the medical field, HDK will have a club, and this club have a bi-weekly online meeting, try to introduce what the medical field and the medical field and how to apply the AI also as a research tool in this field. Okay, that's all I want to say. Okay, thank you for your listening. And I may have some time, I don't know, may have some time to answer your question. But here, I just briefly tell you how the AI application, I don't go very detailed how the method, and if you are interested, maybe you can find out later. Okay, thank you.
Thank you so much, Dr. Huang. I think if participants have questions, would you be able to accept them?
I can tell a few questions. Yeah.
Yes. There is a question. I'm going to pass the mic.
Thank you. So Professor Huang, I would just like to ask, so if we're going to do like some independent research on like the AI and medicine, so are there any like public data sets out there so we can use?
Okay, they have web. Can you hear me? Can you hear me, right?
Yes, yes. Yeah, Professor, we can.
They have some public website have some data, but first of all, that data have limitation or that data may be too old. So right now you have to do maybe you have to work with the hospital. But one thing here, you can work in the hospital to all the AI application in medical, but you have to do it in hospital because the patient data cannot release. Okay. That answer your question? Yeah. So you need to let me know because we in Queensland we have two very close by hospital. They may have chance do some like the image segmentation or all these. Yeah. That one is very nearby in DKU in the Ma'an San Lu. That's the Chinese medicine hospital. Even they call it Chinese medicine hospital, but they really is not Chinese medicine, Western medicine. Another is far, it's called Youyi Hospital. I think we may have chance to work with them to do some image process. Okay. Yeah.
Okay, thank you.
Thank you, Professor. There's one more question.
Sure.
Yes, thank you, Professor Huang. I really learned a lot from your speech. So I have a question about the model you choose. You mentioned that previously you used the residual model and go to the UNet model, and finally you found that the attention model is the best way. So as far as I know, the UNet is released in 2015, which quite an old model. And recent years, there's many of these new models that you can see from these. Say, I saw some articles in archive. So do you think, like, if we want to today we want to build an application, like say we have a data set and we can use which model to predict it, do you think like UNet is the option, good option, or you have other recommendations like the latest, newest, and the most powerful models?
Okay, the one I show here is some is the past experience, some is current experience, some is future question. So the one you mentioned is about, I would say about 5 years ago. At that time, that's my number when my student work. They try to these 3 different methods to find out which was the better one. So that is his conclusion, but not necessary for now. Okay, not necessary for now. So all I talk is not really update technique. I just give you some idea, some direction, what's going on for AI application in medical field. Then you can try different model or different method, not necessarily limited to the method I mentioned about here. Okay, for example, now they do the Monte Carlo. I don't know how many people know the Monte Carlo. Now the Monte Carlo, the question of Monte Carlo is too slow. So now they use Monte Carlo, they have used from the CPU go to GPU. And some GPU may not fast enough. So they may have a new Monte Carlo code coming. Okay, so don't limit whatever I mentioned here. Let's just give you some idea what's been going on for AI application in medical field. Yeah.
Okay, thank you. Yes, I know that this, especially recent years, the transformer-based attention block is really swapping the whole computer vision. It's very good. So maybe if I plan to do the hackathon for this project, I will try these models and probably add some like this attention mechanism to it. Thank you.
Yeah, sure. So that's why I say for the medical field professional, they really don't know what's going on in the AI or deep learning or any model. Okay, so we just use that to apply medical. So if you guys have a better idea or better modeling, then make it speed up or make it get better help in medical field. Because medical field is still a lot of problem, like image, like all the therapy, because human being first of all, for the machine learning, I believe is more stable. Human beings, they have a lot of things. For example, today you argue with your girlfriend, next day your work is not real good, so you make a mistake. But AI never have happened this. Okay, so that's great area for you to apply to medical field. Okay.
Yes, thank you, Professor.
Okay, do we have any other questions? Can you hear me, Professor?
Any question?
Hello.
Any more question?
Battery died.
No. So if you have further question that apply to medical field, I think you got my email. Just email to contact me, and we can have a discussion over here. Okay.
Can you hear us, Professor?
Yes. I can hear.
Sorry, the mic's battery is down. Isn't working. Hello. Okay. Hello.
You might want to check
Cool.
the close the chat.
Huh?
Close the chat.
What chat?
Zoom chat.
Can you unmute yourself?
Can you hear, can you?
You can use it.
Hello, Professor.
Hello?
Can you hear us now?
Yeah, I can hear you. Okay.
Okay, sorry, we had
Next time
we had
you
an
need
issue.
the AI to help.
Yeah,
AI
we had
never-
a small issue with the mic. We were not able to speak.
Yeah,
participant.
I can hear you. I can hear you.
Okay. Participants, do we have any other questions for Professor Han? Okay. Seems like thank you so much again, Professor, for joining this event to make a speech on AI applications in medicine. I think our participants found it really useful, especially because one of our hackathon's track is health, and some participants were interested in building application related to health. And seems like they probably have pretty good ideas now about what to build. Yeah. Thank you so much for making this event special and for your time. Yeah.
Okay, thank you guys. Okay, bye-bye.
Thank you, Professor. Bye-bye.
Bye.
Scotty, I think now we will continue the team formation for roughly 20 minutes before Aziz's speech will start. Okay.
Okay, I'm gonna end the recording and the live stream, and I'll close this room and open it again so I can download that stuff real quick.
Okay. Okay. Sardar will join Zoom. Yeah.
Okay, real quick, who is controlling HackDuke at DKU, the Zoom account?
Sardar. It's Sardar.
Sardar, it's best to text me on WeChat because I have a lot of stuff going on with my phone. So if you text me on WeChat, I'll see that much faster than.
Okay. Sure.
All right. Sardar, I'll text you when I open this room again. It'll probably give me 2 minutes.
Okay, fine.
All right. I'll see y'all again.
Okay. Formation.